Well, David, this is the first time we've talked since after the election.
You're right. I was just thinking about that as we were getting started.
So maybe we'll provide sort of a high level overview, but then we really should focus on what needs to happen between now and next year. We call this period the lame duck, and it's really as the Senate, the House, and the presidency will be turning over in January. So, for those of you who were not following the election results, it was really an overwhelming victory for the Republican Party and for the sort of former president and future president Trump. His vision for the Republican Party. They won the White House. They won the Senate with 52, 53 votes. There's one still contested. And they're going to win the House with about the same margin as they had before, maybe a little less, but still enough that the votes really were a mandate, at least from my perspective. What do you think?
Well, yeah, the whole movement was a mandate. There was no doubt about it, and you can read it a lot of different ways. But part of it was there was no mandate from anyone saying that they wanted to continue with the government structure that the Democrats had offered in the last couple of years. And even though the House may be a very, very, very narrow majority, the Speaker of the House has a lot of power in that body, and that allows them to set the committees and set the agenda of what goes to the floor. So it really is a very big. I mean, in the Senate, everybody's got a lot more power individually, but in the House, whoever sits in the Speaker's chair and whoever chairs the committees are truly kind of driving the boat.
Yeah, I think that's right. I guess that just to have the last word on all this, the other piece of this is I think the mandates for change, but it may not be for all of the policies that were discussed. And we can get this into this in a future discussion, but there are a lot of state resolutions around abortion where, you know, maintaining sort of pro-choice policies were successful on the ballot initiative, but then President Trump won the White House. If there was a senator up, the Republican senator usually won, et cetera. So there is some conflicting data here that we'll have to spend a little bit of time on.
That's true. That's true. That is exactly what we're going to have to be doing for the next 2 months is getting ready for this. Shall we talk about what needs to happen?
Yeah, I think that's a really good idea. So we've got about 6 weeks till the end of the year, and kind of curious as to what has to happen, what may happen, what's not likely to happen. So let's take those one at a time. So what has to happen?
Number one has to happen. The government must be funded to go past December 20th. That's all there is to it. That's when the funding ends. Without it, the government shuts down. There is no interest in shutting the government down on it by anyone on any side. That's not really up for discussion. The discussion about that had always been, well, did you want to give, depending on who won, did you want to give Harris more control at the beginning or give Trump more control at the beginning? Well, now that you have Republicans in charge of the trifecta of House, Senate, and White House, they can kind of do a little bit what they want. They can kind of set it like they could do in a 60-day extension, which would possibly make sense because something of that nature. Because as you know, our favorite topic, reconciliation, is if they come in the early months of the new Congress and pass a budget and pass all a whole lot of different things here, they get a shot at reconciliation, which is the magic wand. It's the one thing that doesn't have to have a supermajority. Doesn't It's you can't like amend it. It's just really a very powerful way to get what you want through, and that was something that they were that has been used a lot in the last couple of years. So I would go for reconciliation. So therefore, pass your spending bills, give yourself enough time to get the new ones ready, and then be prepared to like set your agenda in spending. And it's somewhere in the first quarter, late first quarter in 2025.
Yeah, it's interesting because I hadn't thought of the reconciliation part of this discussion, but I think you're 100% right, which is if I were um, in the congressional leadership, if I were in the Republican congressional leadership right now, I would be trying to do everything to just get us to early next year where we have control of the government, and then we can start to be very directive in terms of, the first steps probably, some sort of tax cuts and then moving from there. So beyond sort of a stopgap spending bill, what else needs to happen? And I would assume such legislation would just be a continuing resolution where we just, continue to roll over the current funding levels.
Um, that's what I would expect that to be the case, and then go forward with something that would give you an opportunity for reconciliation next year. But the thing that one other thing that has got to happen, there's a couple things that
Well,
have.
David, before we move on, I just for our audience, I do think this is important because I'm doing the math in my head. So FY 2025 started on October 1st. So in theory, we may have 6 months of spending in fiscal year 2025, kind of at the same level as the previous year, maybe with minor increases. And then it'll be that sort of second 6 months of 2025 where you might start to see spending cuts, et cetera.
Yeah, it might be more like 4 months in 2020 to 25 and then 8 months. I mean, I'm not quite sure
Yeah,
what
yeah, but
what
I'm just sort of thinking I do, but I think this is an important point as you're, trying to budget out. If you're thinking about like NIH or something that is dependent on appropriation spending, I think that's an interesting issue. I interrupted you. So what's your
that's okay. But it is good for everyone to hear that, there's not a magic wand that just lets you go in and rearrange all the dollars in the budget.
right?
And if you want to, that's just it's there are ways in which this is done that are governed by law. But okay, I just with two things on healthcare that I think we should just hit before we move on to another subject. One of which is telehealth waivers. Okay, telehealth waivers were extended through the end of 2024. Everybody wants to see them succeed. They want them not to go away. Um, I would be very, I can't say for sure, but I would be very surprised if something didn't get included to extend the waivers even just another 2 years. Even give CMS, Center for Medicare and Medicaid Services, the ability to like collect more data on telehealth and what it looks like. More and more, there seems to be very little data substantiating the idea that telehealth erodes quality. But having said that, many of our members know that there's times when they don't want to do telehealth; they want to see the person, and that's totally understandable. But Congress would like to see these options remain in place.
And that's bipartisan, bicameral support.
That is
Yeah,
actually very much so
that's
that way.
great.
It is one of those things I think. So I would be very surprised if that didn't happen. So there's one more item that I think is really important. As we know, over the last 2 decades, the Medicare physician fee schedule has not kept up with inflation, and it represents a decline of 29% of the value in the last 2 decades. That leaves physicians in 2025 in Medicare getting a 2.83 cut of their total income. What is out there is a proposal, and this proposal is a bipartisan proposal, and it's got support in both House and Senate, which is to restore that cut and take the Medicare economic index, which is 3.5 for 2025, for practice inflation, and cut it in half and restore the cut and then give a 1.8% adjustment upwards positive. So that is something I think has got a real chance of happening at the end of this all. And that's something we've been working on a great deal, and everyone in medicine has, and AMA has been really taking the lead about it. And I kind of was hoping you might tell us a little bit about how AMA is going. You were visiting with them just in the last week or so.
Yeah, so I was able to represent ASN at the AMA interim meeting, which took place in early November. And it was really interesting because I would argue that this was the number one, two, and three issue. And obviously AMA is the biggest tent organization. They're interested in a lot, but this was the issue that everyone wanted to talk about. I think there's sort of three elements to this. So one is what happens at the end of the year, and is there an opportunity for kind of what I'll call a short-term fix, if that's the right way to put it. And it's interesting too, because I remember I once looked up where the term lame duck comes from. And it's essentially that there's a flock of ducks, and one of them's weaker than the others, and so it's vulnerable to predators. And you sort of think about that. That's how we use the lame duck session, which gets to my second point, which is there may be a real opportunity, because this is going to be such a big piece of legislation, to attach other things to it. So I'm curious if you agree that there might be a flurry of other sort of last minute healthcare things that people try to slip in, either around the Affordable Care Act or around other sort of important policies. So I just sort of flag that as sort of a second piece. And then the third, which is this is where a lot of the discussion at AMA went, was okay, now what? What happens next year? What's the long-term solution here? I do know that there's starting to be a lot of conversation that you can't move forward with trying to address financial concerns about the Medicare program without addressing this issue. And I heard a lot of anger from physicians, not just nephrologists, but pretty much every type of specialist in every part of the United States, about their scope of practice, about their reimbursement, about sort of electronic health records and the practice environment and administration. There was conversations around, is it time for physicians to unionize, et cetera. So I think it's going to be interesting, because if this doesn't happen at the end of the year, I could see just that may be the last straw for people, and not sure what that looks like, but I can say that the anger at the AMA was palpable.
You know, that actually sounds like an extension of the conversations we were having in San Diego at Kidney Week, because I was hearing some of those same concerns all told together. And also, one I would throw in there also is the way in which value-based care has been run. How are they going to keep docs engaged in value-based care, because it's beginning to run off the rails a bit. So there's a lot there. I think in terms of where you started with your point, how tightly the speaker and the majority leader in the Senate, and when I say majority leader, that's Mitch McConnell, but it'll soon be John Thune, and from South Dakota, and so that will be where they really kind of will flex their muscle to see what they want to keep out. So when people want to bring things, we also call these Christmas tree bills, because they come in around Christmas time and everybody's got an ornament they want to hang on there. So if they are going to be really disciplined, they're going to try to keep from having too many Christmas bulbs on there, and they'll be partially successful. But how tight they want to be is probably up for determination. But I imagine they're going to want to try to keep it fairly controlled.
Yeah, it's interesting. I would think it's a 51-49 sort of percentage bet. You know what I mean? Like it's a coin flip in terms of, I could make the case that for some people, particularly those who are retiring or who are voted out of office, this is a last opportunity to get something. And then for others, they're going to use this for leverage for commitments next year. So again, I think I could see it being clean, as you're suggesting, for all the reasons, with sort of process. But I could also see all sorts of things being attached at the last minute just to get it over the finish line. Because if I'm the Republican leadership, I'm just trying to get to next year, and so I kind of don't really care what happens as much in the lame duck, at least because there's such opportunity next year.
Yeah, I agree with you. I don't think they're going to keep the floodgates completely closed. I just think that I think they're going to try to open them like it's early spring. We haven't had all the rains yet, so let's not open them completely.
Well, David, thanks. As we think about the next couple months in our future podcasts, we'll obviously want to spend some time on summarizing what does happen in the lame duck, as well as um, really focus on what's likely to happen kind of in the next year, particularly the first quarter, where I think there's going to be a lot of activity. And then we can circle back to both some of the conversations you had at Kidney Week, as well as, what I learned from AMA. And I'm about to head to the Council of Medical Specialty Societies meeting, where I'll pick up some more intelligence. So, as we approach Thanksgiving, there's clearly a lot happening in the policy universe.
Absolutely, without a doubt.
All right. Well, thank you.
Thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.